on here live. I know it's been a while since I've been on. Quite frankly, it's been pretty inactive over here. There's a part of me that's so excited about getting to Boston that just hanging out day to day is driving me nuts because I'm so impatient. Also, I've been dealing with a back issue, but today I got back to the gym. I'm so excited to be back. But it took a good week for my back to heal enough where I felt confident that I wouldn't do something stupid to it in the gym. So I'm also hoping that I'm using my phone here. As you can see, I'm in my car with a microphone, and I'm kind of I want to get some feedback from you guys if you can hear me, if it's going through, if it's posting right away, and if you're seeing this, because once I get to Boston, I'm not going to be carrying my computer around to places, and I want to be able to update you as I finish up lab work, and when I get done in the MIT Media Lab after doing some of that pre-operative stuff. When I'm in the hospital, I want to be able to use my phone. I don't want to have to carry my computer everywhere. So if you're getting on here, if you could just let me know that you are hearing me, that it's working, that you're seeing this live. Like I said, I got to the gym today. I'm really, really excited. I can't wait to get out to Boston. Had a good talk this morning with Dr. Hugh Herr from MIT, just a little bit about what to expect. And it was really interesting because I was like, take me through this, Amy. Like, what's the healing process? Because I healed obviously from an amputation, and that was traumatic in all aspects of that word. But then I had the TMR surgery with the nerves a year later, and that was a pretty simple recovery, 4 weeks back in my socket. So I just wanted to ask him what that looked like. They are thinking that I truly should not be in a socket for at least 6 weeks, if not 7 or 8. That's going to kill this girl. Oh my God, I can't even begin to tell you. I am the most impatient person in the entire world when it comes to especially using crutches for 8 freaking weeks. Most people think I'm really patient because I homeschooled my kids. Absolutely not. I asked God for a lot of patience during those years, and that was not a good lesson. Don't ever ask God for patience, because he tests your patience to give you patience. But I'm really excited because it's right around the corner. My God, we leave on the 14th for Boston. I spend a couple days just enjoying the city and prepping myself for a week of a high intensity activity, a lot of MIT lab work. I think they're going to do a lot of baseline work while I'm at MIT, and just seeing what my muscles that I have now do, because in a normal amputation, really they just cut that muscle, cut that bone, and they leave extra muscle past the bone so they can wrap the muscle around the end of your limb. And that has literally not changed for centuries. Like, that is the way they used to always do amputations. That's why this Amy procedure is so different, because it is saying, what can we do to keep some functionality of the muscles? Because right now my muscles are just hanging out. They atrophy. You've heard people say that before. And when they atrophy, what I had found out and talking to Hugh the other day was that after many, many years, which a lot of us amputees don't even really think about, we only think about the now. Like, how do I feel today? I feel like crap today. Everything hurts today, phantom pains today, or I'm feeling great today. But I'm curious about my next 10, 15, 20 years down the road. I mean, what happens with atrophy? Does it keep atrophying? Have I stopped? No. What I was told was, and at least with what Hugh had gone through, is that he now is like skin and bone in his sockets, which is very uncomfortable, he said. And so I want to think about what I can do for myself 20 years down the road. I don't want to be sitting in a wheelchair prematurely because there's no way I can put weight into my residual limb. So that Amy procedure that I'm going to go through on the 20th is supposed to assist with that. And so I'm really excited about that. Not to mention, after trying to do legs today, I could feel, now that I know there's a screw in my femur or coming out of my femur, I now can feel it as I'm doing exercise, which is just cringy, like totally cringy. Now I understand, though, why my body was reacting to certain exercises, because of the push I was putting into the inside of my socket was literally causing me so much pain because there was a screw. So anyways, just wanted to get on, let you guys know, thank goodness my back feels so much better. I'm back in the gym. I'm getting psyched, getting ready, only envisioning positivity, only channeling positive emotion, only channeling positive visualization. Won't even allow negativity to get in. I won't even talk about the what ifs, because that gets you nowhere but into an anxiety area, and I'm not going there. So I'm really excited to feel better, to get stronger, and to become more bionic if I can. So stick with me on this journey. If you aren't subscribing, please subscribe, and please share. I just really want to be able to share this journey with so many more people. And because this vlog is so new, my following is pretty small. So anything you guys can do to help me out in sharing the message, I appreciate it. You guys have an amazing day. And remember, one leg is enough. Take care.